Hello, everyone, and welcome to another episode of Innovation Saves Lives. You have your host, Leonard Kidd, with Jeffrey Miglicco today, and we're going to be discussing his company, PureWay Compliance. And PureWay's been doing a lot of interesting things. Before we get into that, Jeffrey, do you want to kind of take a moment to introduce what PureWay Compliance is, what your role is within the company, and how you kind of transitioned into this position?
Sure, yeah. Well, no transition. I'm one of the original founders of the business. So we started this company back in 2013, but the company's called PureWay Compliance. Quite simply, we handle pharmaceutical waste safely, responsibly, compliantly, and mainly focused on the injections.
Hmm.
So technology changed. There's a lot more injections that are, being done at home. And modern medicine has, I'd say, progressed, but the support system to that hasn't progressed as much. So there's a gap, and there's risks, and patients and protecting the environment hasn't really caught up to this new waste stream that's hitting homes. And PureWay's here to close that gap. I'm the CEO. I've been running the business since we started, and it's been a great company. We started in the healthcare world first. It's heavily regulated. Help them get rid of waste the right way. Offer some sustainability options. And a few years ago, technology changed. These auto injectors came out. GLP-1s. More people disposing, or more people are doing injections at home, and we went after that market. Found there was a huge need, huge demand. A lot of people just don't know what to do with any type of injectable at home. So we're here to help educate, give some guidance, make it easier for them. That's about it.
Yeah, I can definitely see that. I mean, GLP-1s, Ozempic, and all of those, they got extremely popular in the last year or two. But before that, like, would someone really have an injectable at home? Maybe, but probably not too many people. But now everyone's kind of got this. And then when you kind of think about the medical industry as a whole, you have all the biohazard things that you kind of dispose your needles and everything into, any kind of gloves and all of that. But that's not really taught at home. And then I think a lot of people are like, what are we supposed to do with these? Do we stick them into a drawer? Do we just throw them into the trash regularly? So why don't you kind of walk us through like exactly what people should be kind of doing in these situations?
Okay, good question. So, in the past history, let's go back 10 years roughly. The main population that was doing injections is diabetics,
Yeah,
right? Diabetics for insulin and so forth. Now you have diabetic pets, you have GLP-1s, you have Botox at home. So there's a lot of injections at home. That what are people doing with them? They're sticking them in milk jugs, they're sticking them in glass jars, they're putting them in the trash. That's when they're at home. But if
yeah,
you think about those that are injecting that are not at home, they might be at work, they might be at the airport, they might be at a bus station, they might be at a train station. So what is going on there, and what are the issues showing up? Well, you go into any major entertainment center or airport, you'll see a sharps container in the bathroom. Most of them are full because there's so many people injecting now. So
yeah.
they're flushing them.
Hmm.
And the number one, I'd say, job out there, other than a healthcare profession that is encountering needle sticks, is plumbers.
Hmm.
They're clogging up, toilet, whatever. They go in there and they change to go and fix it, and then next thing you know, a needle comes out and they get stuck. So what should they do with it? Well, there's options. So we manufactured and invented this mailback system years ago that includes a container, concludes a box bag, and a shipping process that's permitted, approved. It's basically designed to keep needles and syringes safe at
Yeah.
home, away from pets, away from small hands, and then shipping it. So that's an option, right? And there's a
Yeah.
cost to that. It's small, it's inexpensive, but let's say somebody can't do that. What else should they do? So the best way to contain any type of needle syringe at home is a detergent bottle, right? If you can't get rid of it the right way and you're just wanting something to keep it safe while you put it in the garbage, detergent bottle, duct tape around it is your best bet. But everyone has to deal with the issue when trash is picked up. The first thing that happens, the trash companies compact those containers. It bursts, and that's when the needles come out. That's why you'll find a syringe on the side of the road. It fell out of the back of a truck or next to a dumpster. Our waste stream, our waste system is not currently set up to handle this waste. which is why there's such a big need for it right now. And people don't want to throw it in the garbage. They actually feel uncomfortable having this waste in their house, and they want to do something. So we get calls all the time saying, what should we do with it? So we give them options for mail back. There are some state-funded programs out there. You can ask the person that manufactured your injection. You can call them. In some cases, they have free programs. You just have to ask for it. Say, can I have a container? We work with many manufacturers. They're great. They pay for it. Some of the big GLP-1s that's out there, they have access to it. You have to reach out and talk to their brands and ask for support. So the biggest thing we're trying to convey is, don't be okay with throwing in the garbage. Don't flush it down the toilet. Ask. There are options that you can do to get rid of this type of waste, for sure.
So earlier you mentioned, yeah, sometimes people will be out and about and then they'll maybe need to do an injection. I know my grandpa had diabetes, and when I was growing up, I watched him do the little needle injection. And
Sure.
let's say he was at like a train stop or something and had to go and do that then to check his blood sugar levels.
Mhm.
How was he supposed to dispose of that, like in a neat way? Like, of course, you
Yeah.
can't throw it into the toilet, like you mentioned, or else the plumber
Right.
is going to have to deal with it. Plus, that could also cause maybe some issues with the water system as well, which affects
That's
all
right.
of society. And we already hear a lot about all the other pharmaceuticals that are in the water supply now, so that's
Right.
probably not the best option. And
Right.
then you said the syringe boxes that are there usually end up becoming filled just because there's such a high usage of syringes now.
Right.
So what are people gonna do? Like, you just toss it in the
Yeah.
trash? Probably not, right?
No, absolutely not. There's plenty
No.
of things you can do now. Like there are these transport tubes that you can get that are very small. We have this thing called a 1.4 quart. It's about the size of a Gatorade bottle, right? They carry these with them, and some people have big, injections. You're talking about a little pin needle. Some people have, syringes that are this size or the size of a
Yeah.
marker. What do you do with those? The idea is just to have and to plan so that when you do the injection, you can put it in something. So when you get home, you can then stick it in a bigger container or take it to a collection site, right? There are many
Yeah.
of those as well. Just want to plan accordingly. If you know you're going to do this, it doesn't take much to do it. Just good to know that there's devices out there that can actually, they're designed to be, traveled with to collect all of these injections. Because some people think it's simple and they toss it in the garbage, no big deal. Somebody gets that trash, they bundle it up, they walk, and then you've got a trash bag looks like a porcupine, and
Yeah.
someone gets stuck. Well, someone gets stuck while they're on the job. They're legally required to go and get tested for HIV and to go through vaccinations. It's a
Yeah.
very problematic process that people deal with. So it's not okay to throw it in the garbage and in just because someone's not slapping you with a fine. It's a big problem. You need to just plan accordingly, right? And a lot of these medications are coming out. They already have programs for it. Just ask them.
Okay, so you kind of mentioned a few downsides for just like throwing this thing away in the trash.
Yeah.
One is it could fall out of the garbage truck. Two is if the worker ends up getting stabbed, they have to
Right.
go through a plethora of processes to ensure they're healthy and get back to work, which could
Correct.
be overwhelming. What
Sure.
other outstanding situations are there that kind of cause issues? I think you kind of mentioned like the trash system's not able to dispose of them and so forth, so it might cause a pollution issue. What other
Yeah.
issues are there as well?
Well, a lot of things. So you've got a enormous amount of plastics, right? All of
Yeah,
these injectable devices, they're made from plastics. They're not biodegradable material. So if you think about all the diabetics, 50, 60 million people that are diabetic, you have GLP-1s, MSRA, psoriasis patients that are doing injections, hundreds of millions of injections on an annual basis, just going straight in the garbage, right? Um, Part of our program and what we have is a way to not just dispose of it, which means you kill the biologics that are there, any bloodborne pathogens that are there. Some people have diseases that, these things can spread. The likelihood of it is small, but still, you're putting a waste that's in regular trash not supposed to be there. But anyway, so we've got a way of treating this waste the right way. running it through a process to where the plastics can be separated, the recyclables can be separated, and actually goes back into this, this workflow to where we recycle, up to 85% of the plastics that come back. It's a huge program. We've worked on it for many, many years. We've got the facilities in place. Even our containers are made out of special material that can be recycled. We had to engineer and reverse engineer this so that we had enough waste. It was all of the right materials so it can go through the waste stream in a way that it can be recycled. So, it's the right thing to do. It's a way to protect patients. And yeah, we can recycle the waste, which gets it out of the waste stream. So we touch all three.
Yeah, and I think a lot of people, what they do want to do is do take care of the environment to ensure that it's able to last for as long as possible. Because with
Right.
global warming and all the other pollution issues, there are a lot of people take those conscious efforts for recycling. And I think when you're in that situation where you're like, okay, needle, does it go in the trash? Does it go in recyclable? And you don't really know. And for there to actually be a recycling process for that, I think that would be enlightening for a lot of people for to go out there and give that a try because that I feel that a lot of people morally do want to go and follow through that process as well.
Right. Yeah. And, most people want to do the right thing. And it's not that people, are doing bad thing by throwing it in the garbage. But I know, look, it's not illegal, right? But there's a lot of things that aren't illegal that we probably shouldn't do, right? But it's a convenience item. It's just inconvenient to try and figure out what to do with all this waste. So, having a convenient item to place things in, that's great. Being able to recycle it, a lot of people, care about that nowadays. But more importantly, just not putting it in the trash, or some people just store it. They don't know what to do. And, we work with a lot of veterinarians. You'd be surprised the number of injuries that dogs and cats are getting now because, injections that have been, used and are stored, they have a certain smell to them. And these animals are getting into it. You have where dogs are getting syringes pulled out of their gums because they're going in, chewing up a container or chewing up something that's in the house and getting needles stuck in their actual, in their face and such. So it's a big issue, and to help protect the pets,
Yeah.
makes it easy, gives you an option to dispose of it the right way, right?
Yeah, it's really it could be really traumatic for someone to see their pet digging through syringes and ending up seeing that they got into it, and then what's even worse is having to take them to the vet. What's an emergency bill for a vet around like 400 or 500 bucks? So that could be very costly. The pet could be in a lot of pain. And avoiding that type of situation would probably be ideal for a lot of people. And if they didn't know about this option, this is definitely one of the things that they could go out there and do.
Right. And what's interesting, I relate to the feeling now more than ever. So when I was younger, my wife and I, we had kids very, very young, and I remember she got very, very sick.
Hmm.
So part of that and going through her pregnancy is she had to do injections daily, and she had an IV with her. It was very, very tough. And we didn't know what to do. We had a small baby. We had needles in the house. I was worried about them. I had them on top of our kitchen cabinets in a glass jar. It wasn't something I liked that was there, and they stayed there for years. And that's when I found, Sharps Container. I found companies that could do this, and that's what ultimately led me to, inventing this process for mailback, because how big of an issue that was for us in the beginning, and just didn't want to put it in the garbage. It didn't feel
Right.
right. Yeah.
Yeah, I can see how scary it is, especially if you have a newborn child, you have all these injectables around, and you're just like, okay, this could actually hurt my child, someone who's born from me. And I think a lot of people might be thinking the same things. And it's good that you were able to go out there and find all the different methodologies and processes to go out there and resolve this issue so you can make an impact on the world. Um, to date, if you kind of think about that process, how much of an impact do you think you made thus far?
I mean, it's a good question. I don't know. Look, my goal in starting this business early on with my partners, we got a great team, is that we did want to make something and create a business that has a real impact. We did it for healthcare, to reduce cost, make compliance better. We did that, which is great. But the patient side has been really special to us because not even that, needles are, you don't see anything on the news about it right now. There's more awareness that's growing. But we get people all the time that call us and they have much bigger issues. They've been storing for years.
Wow.
Diabetic patients with garbage cans filled with syringes, and they don't know what to do. So providing an option, regardless of cost, it gives them a real peace of mind. So it motivates me to know that we're doing something that gives people peace of mind, does address a real issue that's out there. It's not just, like a better TV. That's great, but it's a business that is impactful, something you can look back on and be very proud of. And if you think about it, we ship, over 1 million of these containers a year right now. Assume each container may hold a couple hundred injections. We've been doing this for 13 years. It's a pretty big impact. How much I couldn't tell you, but it's in the 100 millions of what number of injections we've brought back. It's I'm assuming you think about the total number there. It's a big number. So that's good to know we were a part of that and were able to do something about it.
Well, I mean, shipping out that many units, 1 million units each year, and getting back probably 100 per each when you round it out, that's a lot of homes that are being cleared out of inventory of just needles that just are taking up space and being a hazard to anyone or any animals or any children who could be around. Plus,
Right.
I mean, consciously on those people who were saving them, they at least weren't putting them in the trash and putting creating other issues. So they took some responsibility at least at keeping it home. And then for you,
Right.
you were able to go out there and clear that all out, fix the trash situation, get these recycled, and get these rebuilt and everything. So I think that's kind of a huge impact when you really put everything all together, and I think that's kind of amazing.
Yeah, thank you. I mean, like I said, it's never anything we thought we'd do, but it is a great accomplishment, kind of what we have done. But more or less, it's great that people are wanting to actually use services like ours. Everyone doesn't. Not everybody can afford it, right?
Yeah,
But I think the environment now and the society now wants to be more proactive about these things. So
yeah.
it's the environment that really gets to take the credit because people want to do the right things. We just happen to create something that fits that need for now, which is which is great. Feels great.
Yeah, I think that's pretty amazing to hear. Some people who's listening to this might be wondering, like, what's the cost to do something like this?
Yeah, good question. Like I said, so in a lot of cases, it's no cost depending on what type of medication you're taking. You can reach out to your own manufacturer of, again, some of the big brands that are out there. They have support lines. You reach out and say, how do I get rid of my syringes? Do you have a program? And they'll provide it at no cost. If that's not available, they can go on our website. It's pureway.com, and we got systems that range anywhere from 25 $30 up to $250 for big cans to get rid of a lot of waste. We've got programs, a great new subscription program online that people can go to that helps them figure out, what should they do with the waste and what does their state say that they should do. And we just launched a new consumer site, which is great. Helps them walk through, like, here's the injections I'm doing, here's my injection frequency, and then we recommend a container that's there. And they can even set it up so we automatically ship them one every month or 6 months or whatever, just to make it easy. Just like mail order pharmacy, except we're going to be picking up the waste versus providing the medications.
That's kind of interesting to go out there and set up a program where you could say, again, injectable every Thursday. That happens once a week. So you're able to calculate out that happens 52 times a year, and you're able to get the right size container to them and the right time to reorder everything. I think that kind of program is really interesting because you don't really see that in the recyclable industry for sure. So, I mean, I think that could help a lot of people really plan around how to go and do this to kind of make it be like clockwork. Because I feel one of the biggest issues for a lot of the things that you buy online is you buy it and then you use it. Then when the bag's like let's say it's like cat food, for example, when the bag's like this far low, then you're like, oh, I got to go out there and rebuy it. And then
Oh yeah.
what if the store's sold out of it or there's a different issue? But if it's working on clockwork, then that just makes it so much more convenient, and it just makes it so much easier for anyone who wants to go out there and try something like this.
Yeah, that's the idea. It's convenience. Just
Yeah.
convenience, put it where they need it, and make it simple. We even have this cool process that They don't even need to call and reorder. We can actually have it to where once they ship in one of these systems, it creates a trigger on our end, like the old Netflix model. You drop in the video, you get another video the next day or
Yeah.
next couple of days. The exact same thing. Some people, they have long-term medications they have to take. They have two systems. They use one, send it in. They start using the second, and they get a replacement in a couple of days. Keeps it
That's
simple.
pretty
That
neat.
way, it works with them. Yeah, pretty simple.
What what made you guys go out there and take these proactive efforts to make like a program like this? Because most companies won't take those types of steps.
Yeah, so we wanted look. Our industry is not new. The medical waste industry is not a new thought. There's great companies out there that do this for the healthcare world and so forth. But we were working with and started getting calls. I was at another companies where I learned, about all of this. They're getting calls from people at home saying, "What do I do with this?" They say, "Oh, take it to your doctor's office." Right? How inconvenient is that? It's one or two every now and then, but the calls got more and more, frequent, and it was obvious that there is a huge need for it. But the technology was the challenge early on. People don't want to do it because the business is a trucking business, right? Big 18 wheelers going to pick up hundreds of thousands of pounds. Those are the people that want to do it, and they have truck drivers that's there. I don't have one truck. I don't own one truck. I don't employ one driver. We created a service, a program that uses, a product that gets shipped through the United States Postal Service. Makes it super easy, super convenient. We realized the infrastructure was there. The way to make the economics work was to use the United States Postal Service, very inexpensive items, create a good system, and let the patient, do their own fulfillment, which is they put it in there and they ship it back, right? They're smart. They know how to do it. They want to do it now. Put all that together, you got a really low cost, really convenient way of doing it. It made sense to us. I'm just glad other people felt the same after a while. And now, we've got these big pharmaceutical manufacturers we work with. They're great. They are driving it. They want to take care of their patients. They know that it helps keep patients on therapy longer if it's a good experience, right? This improves the injection journey. Not only do they do the injection, but now, the person that's giving them their medication is now giving them a way to get rid of that medication in a good way. It's a really good feeling, and that's most of it's being driven by them.
That's awesome. So where do you see this company heading in like 5, 10, 15 years? What do you see is in store for the future?
Oh my gosh. The if I had a shirt, I'd have two words on it. It'd be rocket ship, right? Which is the awareness is there. We are doing our best to keep up, not just from a patient expectation standpoint, but the amount of injectables has skyrocketed through COVID, through GLP-1s, this, that, and the other. And I hope that we're able to create a movement in the waste industry that, gets everybody involved so they can do it. Don't get me wrong. I'm, the owner of a business. I love a growing company that's there, but the problem is so much bigger than what we can manage right now. So
Yeah.
the movement is awareness. People should expect to do something with their waste. They should expect the people to, giving the medication to do something with it. And I hope 5 years from now, there's a couple more PureWays up there. Maybe PureWay has a couple more distribution centers and we're taking care of business, right? But that would be the goal, that more healthcare is being done at home. There are companies like PureWay that have programs for them to manage those safely. And it's just a safer, more sustainable environment. That's what I see in the next 5 to 10 years.
Amazing. Well, we're approaching the end of our show. One of the final things I wanted to leave with our audience is to go out there and share this to bring more awareness so more syringes and disposables are able to get disposed of in the right way. Jeffrey, did you have any final words that you wanted to share with the audience as well?
I guess just a thought, right? So, you know, innovation, new pharmaceuticals kind of is there to save lives, right? We're creating new medications to improve healthcare. That's great. But part of that innovation can't just be on the healthcare side. It needs to be on the full life cycle of that product. So the responsible side, and that's what we do. So say innovation, whatever saves lives, which is great. We need to continue that and continue the innovation through the end life cycle of these, very important medications, and do the right thing with them.
Well, I definitely think that you do have an innovation that saves lives, especially with what you've been doing and all the people that you've been able to help in the community, with over 1 million of these being shipped out last year or this year, and also collecting about 100 million different syringes. If anyone out there has these disposable or has these biohazards at home and doesn't know how to go out there and dispose of them, make sure to visit pureway.com. Once again, this is Jeffrey from PureWay Compliance Inc. and Leonard Kim, your host at Innovation Saves Lives, and we'll see you next time. Thank you so much.